Hello, so I'm now going to show you how to do the IM injection for your OSCE exam. So this is an intramuscular injection. So I would start the station the same as you do with all your others, traveling your hands as you know. So palm to palm, fingers interlace, back of the palms, fingernails, centre of the palm, thumbs and wrists, and then approach your patient. I'm going to take my prescription with me. So I'm checking my environment is safe to approach and I'm going to see your patient. So good morning, Michael, how are you?
Okay.
I come to do your injection today. Is that all right?
Yes.
Okay, so I'm just going to check your details. Could you tell me your full name, please?
Michael Smith.
And your address?
12 Fake Street.
Lovely, and your date of birth, please?
21st of the 4th, 53.
Okay, so that matches my paperwork here. Are you allergic to anything?
No.
Okay, lovely. Have you had this injection before?
No.
No. So what this is vitamin B12. So your doctor's just prescribed that for you, and it's every 8 weeks. So I'll give you the first one today, and it's because you have a deficiency in vitamin B12 in your blood. It's an intramuscular injection, so that means it goes into the muscle. So it's alright if I put in your thigh today?
Yeah, that's okay.
You haven't had any injections recently?
No.
No, so that's fine. So obviously we need to alternate sites if the patient's regularly taking injections. And often you have vitamin B12 for your exam, so I would just look up a bit so you know what to say with your patient. Okay. So now I would go and check my prescription and prepare my medication. So looking at my drug chart, I've checked my patient's details, which are correct. I've checked those with him. I've checked the allergies. This is signed by Dr. David Jones, and it's for vitamin B12 IM every 8 weeks, and it's for 1 milligram. And yeah, it's signed by doctor, and it's due now at 12 o'clock. So that's fine. I'm happy to proceed with that. Now I would collect your items. So I've got here my injection tray and my sharp spin. I'm going to clean the tray with this 70% alcohol wipe and check my sharp spin. Obviously it's not full. And again, the same like your trolley, it should be washed with soap and water every 24 hours. Always gel your hands after you've done any cleaning tasks. Okay, here I've got my injection, which is vitamin B12. It's clean, intact, there's no precipitates, expires 22. So normally they give you like a saline injection to give a saline flush. So you need to record the batch number. So you can do this now or once you've finished with your injection. I'm just going to do it now. So there's a space for this on your drug chart. And then get the rest of your items. So here I've got 2% alcohol wipes, which are clean, intact, expired 2022. One small syringe, this one is 2 ml syringe, it's clean, intact, expires 24. One giving needle, which is 23 gauge, because it's IM injection, it's clean, intact, expires 24. One drawing up needle, which is clean, intact, expires 21. Gauze pack, which is clean, intact, expires 2023. A small plaster, they like you to put a plaster over the site on the exam, which is clean, intact, expires 2023. So now I'm going to prepare my medication, so gelling my hands. Either put on your apron now or later. I'm going to put it on now. Okay, so with your alcohol wipe, if you clean the neck of the vial of your saline for 30 seconds and let it dry for 30 seconds, so just start counting 1, 2, 3, and your examiner will tell you 30 seconds is up. So I'm going to leave this to dry now for 30 seconds. 1, 2, 3, 30 seconds is up. So sometimes in the exam they'll tell you to pretend it's glass. So if it's glass, either remove it with some gauze or your sani cloth. So assuming this is glass, I'm going to break it and put the glass top in the sharp spin. Okay. Again, again, decontaminate my hands. And now I'm going to draw up my injection. So using this pink drawing up needle. So I'm just going to give him a mil today. If you have, so I have some excess now, so just let that go in the sharp spin if you've got some excess, or back in your vial. Okay, now when you resheath the needle, do not do it by hand like this. I know it's tempting, and I know sometimes that's what we do on the ward, but do not do that for your exam. Place the needle in your tray, and then you're going to place the needle cap in your tray, and you're going to resheath it by scooping. So just scoop the needle into there like so, so there's no risk of sharp injuries. Now you can remove this drawing up needle and put on your giving needle. Okay. So that's all ready to go back to my patient's bedside. Before I give the medication, I will need to do another ID. Okay, so I'm just going to pop on my gloves before I go back to my patient's bed space. And I will just ID my patient. Remember, in the OSCE exam we need to ID our patient twice and then give the injection. So hello Michael, I'm back now with your injection. Do you mind if I just check your details again? It's just our procedure here. So can I have your full name please?
Michael Smith,
And your date of birth?
21st of the 4th, 53.
And your address?
12 Fake Street.
Okay, so I'll do the injection now. Is that all right? So with the identity check, because it's community scenario, we're not in the hospital, we do the patient's name, date of birth and address, whereas in the hospital, as you know, we do the name, date of birth and wristband. Okay, so I'm just going to uncover you a bit so I can have a look at your leg. Before I do this, I would close the doors, that kind of thing, make sure there was no one else around. So having a look at the skin, making sure there's no inflammations, wounds or anything like that. You need to verbalise that to your examiner. Okay, so I'm just going to clean, it's a bit cold. So cleaning the skin for 30 seconds in a circular manner. So 1, 2, 3, your examiner will tell you 30 seconds is up. Okay, and letting it dry for 30 seconds. I would now get your gauze and your plaster ready. I like to keep it in my tray just next to me. Okay, so these needles have this safety cap, so just need to put it down and remove the cap. Okay, so stretching the skin and then inserting the needle in a 90-degree angle in a dart-like manner. Alright, start scratch, then we leave 1 centimetre out. You need to aspirate, as you know. So aspirating, checking for air bubbles, and then inject it over 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now because this is IM, I need to wait another 10 seconds before withdrawing. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Withdraw it, apply your gauze with gentle pressure. With your needle, resheath it like this or put it directly in your sharp spin. Obviously make sure it goes in your sharp spin. Are you alright now?
Yes, thank you.
Yep. Okay. So just put a small plaster on, so it's not bleeding or anything. I just put a little bit of plaster on, So I'm just going to do my paperwork now and put away my things. Do you have any questions or anything?
No.
Alright then, so if you have any concerns, please call us, I'll give you the phone number. Alright? So dispose of your waste. If you haven't written your batch number down, keep your vial, don't forget to do that. Remove your apron first, then your gloves. Decontaminate your hands. Obviously I've covered my patient as well, and just fill out your drug chart. So you need to put your name at the top. And you need to sign on the right hand side and put the date and the time. And then afterwards, just verbalise to your examiner. I would now wash this before I use with my next patient. And that's it, that's your IM injection.